communications gap existed between Ontario's nursing watchdog and the care home where Elizabeth Wettlaufer killed several residents, the Commissioner of a Public Inquiry said Wednesday, as the two sides discussed why an investigation was never conducted into allegations that the nurse was abusive to patients. Wettlaufer has confessed to murdering 8 patients, and attempting to kill several more, over the course of nearly a decade by injecting them with overdoses of insulin at care homes and private residences across the province. The Crescent Care Home and Ontario's nursing watchdog discussed why an investigation was never conducted into allegations the nurse was abusive to patients. Dave Chidley, the Canadian Press file photo, she was disciplined several times by her employers at Crescent Care in Woodstock, ONT, who ultimately fired her in 2014 after she made multiple errors while administering medication. The inquiry into Wettlaufer's conduct heard. Crescent sent the College of Nurses of Ontario a termination report on Wettlaufer, outlining some of her transgressions, and saying it had several other documented incidents on file, but the watchdog did not probe deeper into those cases. The inquiry heard, "There is a gap here, there's no question in my mind," Inquiry Commissioner Eileen Gillies said Wednesday. Crescent Care thought that it had prepared a report which should have alerted the college to not only to the concerns it outlined but the concerns and incidents before it, article continued. Fellow evidence presented at the inquiry, however, has indicated that the language used in Crescent's report would not have triggered the kind of college investigation the care home expected, Gillies added. Officials with the College of Nurses have recently had the opportunity to review all the incident reports Crescent Care made about Wettlaufer. College Executive Director and Registrar Ann Coughlin testified Wednesday, "There are a number of those incidents that are of serious concern, as they fall into the category of abuse," Coughlin said. The college would have investigated the transgressions had it known the full details when the home informed it of Wettlaufer's termination, she added. In one instance documented by Crescent Care, Wettlaufer allegedly continued to administer a treatment for an impacted bowel despite the patient yelling out in pain, Coughlin. In another case, Wettlaufer allegedly told a colleague to ignore a patient's request for pain medication, telling her coworker to wait and see if the patient rang the nurse's bell again. A significant expectation of clients and of nursing intervention is pain management, and to leave a patient suffering when there is a way to address that is abusive, it's neglect, Coughlin said. Article continued below. The public inquiry is exploring what failings allowed Wettlaufer's crimes to take place, and what can be done to prevent similar tragedies in the future. Gillies is expected to release her final recommendations by July 31, 2019.